Greetings, everyone. Thank you for joining us here at the 1947 Partition Archive. Given the critical situation in India with COVID-19, at the moment, we are adding some new programming to our channel to answer your questions about the crisis. Today's topic will be on recognizing the different stages of COVID, on home remedies, and when to get help. Today's event is co-sponsored by the Million Sparks Foundation. My name is Vikrant, and I'm volunteering to bring you this episode. Our guest today will be Dr. Bindu Balani from New Jersey, USA.
Hello, how
So,
are you?
welcome, Doctor. I'm good. How are you?
Very well. Thank you very much for having me here.
For joining us. Dr. Bindu Anand Balani was the principal investigator in both Moderna's vaccine study and the Remdesivir study at Hackensack University Medical Center, which is part of the Hackensack Meridian Health. She has played a prominent role in ensuring that communities and physicians are equipped with the latest and correct information on how to treat COVID-19. She specializes in infectious diseases and internal medicine. So once again, thank you for joining us, Doctor. To start off, I'd like to bring up a graph with the stages of the illness to help our viewers better understand the process.
Thank you very much. Thank you to all the viewers who are here today, trying to tune into this particular live update. As I was telling Vikrant just before we went live, social media has played a big role in learning processes, both for myself when this was all brand new. I was able to see the first patient at New Jersey and at our hospital. So we really were very, very thankful for all the help that we got through social media, through friends and physicians across the world, in China, in Israel, in UK, to help us get through with our surge. The surge that is there in India will definitely, you guys will be getting through with it. It's a difficult time right now, but we hope to see better times very shortly. So Vikrant, I'm ready with the stages if you want to put that up.
Yeah, sure. We'll get that up in a moment. Okay. Thank you so much, though, for your words. There it is. So, whenever you'd like to start, Doctor.
Sure. So I really wanted to show this particular treatment across the spectrum of COVID-19. This graph was made by Dr. Gandhi and has been very well looked at with different articles, and has been used quite often in trying to teach the various stages of this particular disease. So as you can see from the graph, this particular spectrum has at least 4, maybe 5 sets of illnesses that you can actually cut through. The first part of the stage of the disease is the asymptomatic or even the pre-symptomatic the phase. It goes from the asymptomatic, pre-symptomatic phase all the way to critical illness and then subsequently post-COVID issues and syndromes that occurs with it. So taking through the stages one by one, in the asymptomatic or the pre-symptomatic stage, which usually occurs about 2 to 3 days prior to the onset of illness, at that particular time, the virus is very high. The viral load in your body is very, very high. So you're very infectious to people. The second stage is the mild disease, which happens for about 1 to 5 to 7 days, where also the viral loads are relatively pretty high. One thing that we know about this particular disease is as we start getting more symptoms associated with this disease, the viral loads automatically also start declining. So your height of viral load is highest before your symptoms are very severe. Once the symptoms proceed, they're usually mild symptoms. You could have, going from head to toe, you could have things like headache, you could have a little bit of a runny nose, stuffed nose. You could have anosmia, which is basically a relatively new process that was identified during this past year, where you have a loss of smell. You can have loss of smell, you can have loss of taste, you can have sore throat, you can have scratchy throat, you can have chest discomfort, you can have cough, breathing difficulties, you can have diarrhea, you can have nausea associated with it, with the GI illnesses, and then overall fevers, chills, just being tired all the time. It's amazing how much tiredness you can feel during this particular early part of this illness. So that's usually your mild stage. And as you progress further towards the more moderate illness, where your oxygenation may still be good, it still be above 94%, but you have some markers of disease process that's already affecting your lungs. So one thing that I'll stop and kind of just reiterate here again is if you were to do a CAT scan during this particular time, chances are that you're going to see something there. Even though your oxygen levels are pretty good, you will have some amount of abnormalities that you're going to see on imaging studies. Chest X-ray, maybe not so much because chest X-ray is a little bit less sensitive, but CAT scans would probably pick up that abnormalities on the lungs. But your oxygen levels are still pretty good. It's still above 94%. And then goes on to the severe stage, where not only do you have your abnormalities on your X-rays, but now your oxygen levels are starting to drop. The number that we look at is 94% for the oxygen saturations. For the pregnant host, we have a little bit, a few points above, because again, it's a pregnant host with a child. So we have a cutoff of about 95 to 96% as to what is mild and versus severe. And then, of course, as things progress, it may or may not progress, but if it does progress, it goes on to critical illness disease, where your blood pressure drops, your heart rate's very high, you've got a persistent fever, your oxygenation is so bad that you really need help, either with, a non-invasive ventilation or intubation at that particular time. So those critical illness is usually more grave, more ill, more severe in its pathology. And then the final thing that I'd mentioned before is regarding the post-COVID syndrome, that we are kind of now post-June, July, at least in US, we've kind of figured out that, okay, there's something else after COVID gets done. And we do need to kind of monitor those patients even subsequently. So that's the post-COVID syndrome per se. I'm actually going to go back to that graph again. I do want to point out in the graph, the next one is the disease pathogenesis. What is it that's actually causing the process of either asymptomatic or mild or moderate disease? If you can notice, in the first three boxes to the left, the viral replication rhomboid is the largest, right? That is where the viral load is the maximum at this point. And then as time goes on, as we get more and more severe disease, the amount of virus in the body starts to decline. So after 7 to 8 to 10 days, that particular viral load is pretty much gone. That severe illness, the moderate illness and the severe illness and the critical illness that we kind of go to the next phase with is related to the body's response to the inflammation that the virus caused. So it's like going into an overdrive. I always give a simple example to my patients is, you have a rock that has been pushed down the mountain, and it just has to keep going till the end, till it kind of comes to a plateau down to the hill. So that particular pathway, once it starts, is very difficult to stop. So in that peak of that inflammation is where we have a term called cytokine release storm. What it means is basically that your body's certain transmitters in your bodies are released, which causes your body to mount a super high inflammatory response to it. The last part is also regarding the pathogenesis, regarding the hypercoagulability. What does that mean? We know in COVID that there is a higher chances of forming clots in patients who had not survived, and we had the ability to actually access their organs, and for research and science purposes, we did see that there was a lot of small, tiny clots all over in the body, in the lungs, in the kidneys, and so in the different parts of the body where there are receptors for that particular virus, we were seeing a lot of blood clotting issues. So many a times, the critical illness and severe illness could actually not be related to the viral replication. It may not be related to the, well, inflammation comes in a part, definitely, But the hypercoagulable, or your risk of strokes, or your risk of clots, or your risk of clots to your lungs causing the shortness of breath is extremely high at that point. So based upon that viral replication, the pathogenesis, what is it that is causing the main problem during that particular spectrum, the treatment modalities are then accordingly addressed for those particular stages. So if I were to say that the blue part, the viral replication, is the maximum, that's when I need my antivirals the most. Giving an antiviral when you are 2 weeks into the case and you're on the intubation and you are on the ventilator, it really doesn't work. The virus is not there. It is the immune phase that comes into play that is required to be assessed at that point. So many a times, yes, go ahead.
Talking exactly about that, doctor, now that you've described the stages, as you said, yes, taking a medicine by the time it's too late is just, it doesn't make sense, right? So could you please tell us stage by stage when treatment is required and the treatment's based on the stages?
Sure. So obviously with the asymptomatic phase, you really don't know that you have the disease, right? So keeping that, taking to the next stage, which is the mild phase or the mild illness phase, where the viral loads are high, and it's very early on, the first 4 or 5 days of your illness that you're occurring at that point. In that time frame, you have symptoms, mild symptoms or no symptoms. So if you've got a runny nose, or if you've got a cough, you may want to take some medications to try and help you with the cough, or trying to bring up the phlegm to try and help get the airways a little bit better. Hydration is a key. Trying to get the hydration, trying to get fluids in you, trying to have a good amount of fluids in you to keep yourself hydrated, to try and get that phlegm out and not have a very dry system is, I think, very important.
Okay.
You also have a lot of fever. So with fever, you have a lot of sweating, you have a lot of fluid loss, and you've a lot of salt loss. So again, being very well hydrated with electrolyte solutions, for example, is probably a good idea at that particular time. Trying to take but if you do have fevers, obviously taking antipyretics is important. If you have muscle aches and your body aches, taking some kind of analgesics is important to try and get your pain controls better, right? But trying to take them constantly, I don't think is a good idea, because fever is there for a reason. Fever is there as a body's host response and the host defense response against the virus. So you really don't want to blunt that response. You want it to happen, but of course, if it gets uncomfortable, that's when you want to try and take the Tylenol or paracetamol, etc., to try and help break the fevers. So go ahead.
On that note, doctor, as you said earlier, it's like a little rock that goes down the hill and then it keeps going until it plateaus, right? That's the body's response, and that's what happens in the moderate and critical and severe illnesses, right? It's not exactly the virus, it's your body responding to it. So how does one differentiate between taking the pain meds to reduce the pain and the fever versus letting the body do its job in terms of fighting the fever? It's because it's a little confusing there.
That's a great question. So as I said regarding the timeline, in the earlier part, it is a virus that's currently present. So your body is seeing something foreign, it's seeing a virus, it's trying to attack it, it's trying to do its host defense. By the time the inflammatory rate comes, your timeline is the most important thing. The time of onset of illness is absolutely important to be noted, because we are always counting the days of illness. Sometimes it's very difficult to really kind of figure out, you're working, 15 hours and you're tired, and are you tired because you're working 15 hours, or you're tired because you've got COVID? So it's hard to pinpoint, but again, but trying to figure out that day zero of your illness is extremely important. Now, regarding your question regarding having a fever and taking an pyretic or anti-fever breaker medicine initially is more based upon the timeline. So in the first 5 to 7 days, where it's your virus and your body is trying to fight this off. It's after the 7 to 8 days when you have consistent, persistent fevers, or you've already crossed that first 1 week of illness where the virus is the main issue. Now comes the overdrive or hyperdrive. that's when that fever becomes the cytokine storm. That's when it is associated with a drop in your oxygen. So you have both parameters happening simultaneously. You have a significant drop in your fever and in your oxygen counts, as well as a rise in your body's inflammatory response. And that is a differentiation. So time, a little bit later in the course, you're talking about 7, 8, 10, 12 days into the course. And then you're talking about a marked drop in your oxygen counts. Those two parameters together are required for being a cytokine storm or being in the hyperdrive, as I said before. In the earlier phase, it is a fever and just mild illness and mild fevers that any viral illness is going to form in your body. So that's the difference between the two. And again, even down the road, if you have a fever, you definitely, give you the antipyretics. That's not the issue. It's just that we don't want you to mask it at that point, at least earlier on.
Okay,
Yeah.
great. I'd like to touch upon something that you mentioned. You said that, if you're working 15 hours a day, you don't know if it's fatigue from the work or if it's fatigue from COVID or any kind of viral illness. So who, in your opinion, should get tested? How do we know?
So with that particular concept, so I think I would say in those patients who've had a possibility of exposure. So the first person who gets tested in the house, right? They are the ones who are the first persons that comes along as to who should be tested. Usually we are obviously waiting for either somebody who has known exposure. So you were known about it, there was somebody else that you went to party with, or you were with, or you were in close contact with 5-6 days ago. And then you start having these symptoms of just not feeling well and being fatigued. Again, bling, you got to get tested because chances are you got COVID. The more important ones and the more nuanced ones are probably the ones that you are actually staying at home with, right? So you're down with COVID, and obviously in the pre-symptomatic phase, you didn't know that you had COVID. And then you're staying with your family members, and then when should they be tested? They currently are asymptomatic at this point, and what should you be doing about them? I think one rule of thumb is think that you have COVID. Think that your family members have COVID. And I think once an index person, once a first person in the family has the disease, I think everybody should be isolated. It is an absolute civic duty that we need to stay at home if our family members or anybody in our family members is infected with COVID, because chances of us being infected is high because we really don't know that. Now, again, should you get tested if you are a family member? I think it depends. I think it just depends upon the situation. I know there was a time point here in US where our testing abilities was really bottlenecked because there were so many patients. Our testing results were coming out 4 or 5 days later when it's really past the time. So again, I think it depends upon wherever you are, wherever you're living. I think testing is very important to be able to isolate, be able to socially distance, able to prevent the spread and contact isolation. So I think contact tracing, etc., is very important based upon testing. But if you are in a position where you can self-isolate yourself and there are higher chances of you going and getting COVID by going to a test or not being able to get a test result soon, I think it's okay to wait and watch. And if symptoms occur, then assess regarding the care. Because again, early COVID, there's really nothing specific that you need to do. You need to take care of yourself. So you could just do it yourself without doing a test.
Right. That's great, doctor. Something that really caught my attention was when he said in the US, there was a bottleneck during the testing phase, right? And once people started to get admitted, the same thing happened with the medical system that's happening in India. It got overwhelmed. Of course, in India, it's way more overwhelmed, right? So for cases that aren't severe enough, right, which can try home remedies and these the precautions that you're mentioning, right? For those cases, what would you suggest in terms of okay, now it's severe, you should go to the hospital? Because I want to figure out ways so that this bottleneck can be clogged a little less. So what would be
Yeah.
your opinion be on that?
You are absolutely right, Vikrant. I think the only way to get any reprieve in the hospital systems in India is going to be um, for the public not to panic. One thing is for sure that 80% of patients who get COVID resolve by themselves. So having known that majority of patients are going to be staying mild, I think panicking and getting to the hospital system or panicking and getting to an already overburdened um, physical system, I think is going to be very difficult. So what you do need to watch for, as I mentioned before, is the days of illness, right? So knowing when you started, keeping a tab. I always tell my family members who call me, I said, just make an Excel sheet, put your day 0, put your day 1, put your day 2. And then on that point, just kind of keep a tab on your monitoring of your vital signs, of your signs. I think pulse ox has become, a common fifth parameter. All of us have a pulse ox at home now, and which is a good thing to have. Along with a thermometer and a pulse ox are the two things that you would need for COVID. So you would want, and a blood pressure machine, if depends upon your case scenario. So if you are watching your vital signs on a regular basis, and if you notice that your pulse ox is steady, 95, 96, 97, that's great. But as the days progress, you're kind of watching your pulse ox as being your most important parameter. If you start noticing that your pulse ox goes less than, if on an average you were 98, 99, and then now you start dropping to 94, 95, or 93, a one-time drop or an infrequent drop is still okay. It's normal. But a persistent drop or a constant decline in the curve, if you've kept your monitoring numbers, you'd be able to see that downward trend. So keeping that value of 94 involved is and aware of is very important. So that's number one. One thing I will talk about pulse ox also is how to take a pulse ox, right? One thing that we have to remember is pulse ox is just putting a light onto your fingernail, and that kind of assesses how much hemoglobin and how red your blood is, right? So having a red nail polish is not a good idea. It should be a bare nail polish as much as possible. Keep your hands steady. Put a pulse ox on. Keep it steady for a few minutes so that you have a steady number that's coming through. You can try it a couple times. Make sure that the average is the same to get the pulse ox. I also recommend that you take a pulse ox when you're walking and do a little bit of exercise, just to see that if exercise pushes your numbers down, because that's also a marker of trouble down the road. So if you're exercising and your numbers do go down, but it comes right back up as soon as you relax, it's okay. Nothing to worry about. But keep a tab on it as time goes on. So pulse ox drop down by day number 5, day number 6, day number 10 is important. The first 5-7 days are the milder days. The second half of from 7 to 14 is the critical period time where if things go wrong, it actually goes wrong there. Now, do remember that in healthy adults, healthy young adults, we have a very large what should I say, capacity to really go down on our pulse ox before we start feeling short of breath. So feeling short of breath is yet another warning sign. So if you're breathing faster, so I would also recommend kind of testing or counting your respiratory rate, which is basically how much you breathe in a minute. So you kind of 1 minute, one breathing cycle is breathing in and breathing out. So you want to kind of check yourself for 30 seconds, multiply it by 2, or count it for the whole 1 minute. So keep a watch on your breathing cycles also. If your respiratory rate starts to go up and it becomes 24, 25, and then up to 30, that's a warning sign that you need to kind of be aware of also. Feeling dizzy when you get up, feeling short of breath when you walk or when you talk, unable to keep sentences when you're talking on the phone. Those are markers of something happening on your things. Also, having a cough that you can't hold on to, a longer cough, or chest pain or chest tightness, or pain in your calf muscle. Those are signs of clotting disorders that can happen with that. So those are warning signs that you need to get to the hospital, or at least have an access with your doctors. I do recommend that once tested, at least have a telemedicine visit if you can. Nowadays, I think there's a lot more access that is happening with various NGO efforts, etc., global efforts to try and help give telemedicine as a possibility to at least talk to your doctor about it. And then as time goes on, please keep them in loop. I think it's very important to monitor, and access care as needed. So if you see any of these warning signs, please make sure that you get yourself into the hospital, or at least have a discussion with your doctor, who may then say, go get an X-ray, or go get a CAT scan, or go get a blood test, etc., depending upon the situation.
Okay.
Yeah.
Thank you so much for that. So, however, if we do, go through these symptoms that you mentioned, something that we should immediately do, as you mentioned earlier, is isolate our loved ones as well.
Yes.
Because chances are, if our day zero was yesterday, their day zero is coming up in a couple of days, right?
Very
And the
correct.
timeline is important, right? A few points that I'd like to highlight from what you just said. If your the O2 meter shows 94, 95, 93, below 94 on an infrequent amount, then it's fine. But if it's consistent, then that's a red flag, especially after physical activity. For younger people, count your breaths. That's an in and out cycle over a minute. And if it's reducing, then it's a problem, or if it's increasing, it's a problem.
Higher.
Okay.
And that's the respiratory rate is for anybody, everybody.
For everybody. Okay. And a pain in the calf muscle can suggest clots, which is another sign. Okay.
Yeah.
Brilliant. Yeah. Thank you so much for that. Could you please clarify the uses of plasma to us, and how does it work? When should it be administered? Because it's been all over the media, all over WhatsApp University. We need a clarification from somebody like you.
So plasma is fantastic, but there are multiple things that goes into getting the right plasma. In the graph that I showed before, one of the things that actually was on the bottom of my graph was antibody recommendations, right? So when you are seeing a virus up, yeah, there it is. So it says potential treatments as antivirals on the bottom. There is a possibility of antibody therapy that is earlier on in the mild disease. So when you see a new infection and a new virus, your body has never seen that before. So your body doesn't have any recognition of it, or doesn't have a memory of it, because it's never seen it before. It doesn't have the antibodies that have to be formed. Once you see a new organism in your body, whatever it may be, your body makes antibodies against them. Now, the antibodies that are formed for COVID usually happens about by day 5 to 8 to 9 days, in that frame. So the first 1 week. So when your viral illness is the highest, that's when your body has seen this virus and now is starting to develop antibodies against it. If you are to take plasma, or if the plasma is to be effective, it is effective only in the first 0 to 3, 4 days. That's because you want to infuse the antibodies into your blood, so that when it's actually seeing the virus, these antibodies will not allow the virus to attach to your cell. That's how the disease spreads, right? That's how this disease attacks our human body. The virus attaches itself to a particular specific receptor. By giving antibodies, we are actually giving the antibodies against that particular receptor blocker. So we prevent the virus from entering into a cell. If the virus has already entered, if the virus has already done its job for the first 5 to 7 days, getting the plasma after you get admitted to the hospital because you're short of breath is not going to be effective. So we do not recommend, and I think even the ICMR recommendations is not to recommend convalescent plasma in routine phases. Now, having said that, there are certain scenarios, a certain subgroup of patients where it will help, where it may help, especially like, for example, somebody who's on a specific type of cancer chemotherapy and they're taking Rituxan, for example, for lymphoma, or they're having active immunoglobulins. They need a lot of IVIG even routinely because they have a dearth of that in their body. Now, in that situation, giving them passive immunity may help because they tend to be keeping the virus longer in the system. So they shed the virus longer because their body does not have the capability or armamentarium to really make those antibodies. So in that situation, it may have some benefit, but I think it's a very small benefit once the patient gets into the hospital. So I think that being said, the other part of it is also related to not everybody makes the same amount of immunity, right? Your immunity, my immunity may be totally different. Mine and my husband's was totally different. So when we mount a response, each person has a different level of antibodies that they generate. So if I had the virus and I were to go and donate my plasma to somebody else, I don't know how much plasma antibodies I have. So getting a right quantity of a higher titer of antibodies and higher titer of plasma is also important. So not just any plasma is going to be effective. So if you want to give it, you want to give something which is high titer. So that's the term that we use at this point, is the level of antibodies in that plasma should also be effective enough to make that positive impact. Having said that, so the pros, I think, are great in those patients who can't mount a response, and the pros are fantastic if it's very, very early on. But again, very, very early on, we really don't get to the hospital. So, you know, getting a plasma at the right time frame may not be yet in the first round of therapies. So here in US, we actually have a clinical trial going on for outpatient plasma versus nothing in the first 72 hours of illness. So it's very short duration of time that you need to get the plasma in. So for India, I would say I would not be running around for plasma if somebody's loved one is already in the hospital and already on requiring a lot of oxygen, because by that time, plasma does not work. On the converse, plasma actually may have some negative outcomes. There were a couple patients who had, again, plasma is 200 ml of fluid that's been pushed into you. So if that fluid amount is too much for your body, it can go into your lung and it's going to cause more shortness of breath, or it can cause plasma-related reactions that can occur from antibody reactions. So there are some downsides on taking some kind of treatment. So I always say, we always say, do no harm first. So, we want to try and give the plasma at the right time. And if it's too late, I think we should probably hold it at that point.
Okay. All right. Understood. Thank you. Now, another super important topic, Remdesivir, right? We've been hearing a lot about it. What is it? Is it effective? When should we use it?
So it is an antiviral. It is an antiviral against the SARS-CoV-2 virus, which is the virus that causes COVID. Okay. So, normally we say, oh, if it's an antiviral, give it right away, give it up front. Okay. It would have been great if it was a pill form that we would have done that, but it is not. It's an intravenous form. It has to be given through an IV line, and it has to be monitored setting. It does cause, or it has to be, certain blood tests have to be done, both your liver and your kidney blood tests have to be done before we use that particular medication. The data on remdesivir basically showed that those patients who were moderately ill, moderate to severely ill, with low oxygen, less than 94%, and okay, required oxygen therapy. So you had to have low oxygen levels or oxygen requiring therapies or severe lower respiratory tract illness. In those patients only did it show a benefit of trying to decrease the number of days in the hospital. So instead of being 15 days in the hospital, you were earlier, a possibility of early discharge because you turned around much quicker. So it is important to know that, again, it's an antiviral, so giving it after 10, 12 days is really not going to work. So first is the time cutoff, right? So if you're 10 days and above from the time of onset of illness, remdesivir will not work for you. So it's got to be less than 10 days. It's got to be, in addition, you have to make sure that you have an oxygen value of less than 94%. And you have to have some form of oxygen requirements or some X-ray findings showing significant pneumonia to really be of benefit. In all the other scenarios, it really did not show a positive impact to the subpopulations, both in the milder forms and then again in the critical illness forms. So they did not really show any benefit in mortality or dropping the number of days down in that scenario. So remdesivir, less than 10 days, with oxygen less than 94, and requiring some kind of oxygen supplementation.
Okay.
One more piece of information. With remdesivir, always try and give it with steroids.
Okay.
Actually, I'm going to say one more thing. Steroids in early phase is a complete no-no. Please do not use steroids in the first 5 to 7 days. Steroids decreases your immune system, and that immune system being lower is going to cause your virus to multiply more. So the first week of illness, where the virus is the most aggressive, you want to have as much of your immune system at power as much as possible, and steroids will decrease that immune system. So do not take steroids in the first 1 week of illness. Now, after that, if you do progress and you do have a drop in your oxygen counts, as I showed that first graph, which I think is a very important graph, where your virus count goes down and your inflammation starts to go up, that's where you need an anti-inflammatory. Steroid is anti-inflammatory. So that's where you need to add it with your steroids, with your remdesivir, to have the maximum mortality benefit. So remdesivir and steroids are the only two agents that have shown some positive impact on the outcome of care.
However, given the conditions that it's remdesivir starts 10 days or before, O2 needs to be lesser than 94, and you need to be on oxygen, or you need to have some kind of support for your lungs, right?
That's correct.
The biggest no-no, 5 to 7 days, no steroids, because
correct.
they hold your immune response. Brilliant. Thank you. All right, doctor, I want to touch upon prone sleeping and pruning and its benefits, because the government of India has put out its own document as well with illustrations. How does it work? I understand that it makes your airways more conducive to breathing and taking in oxygen, but why do we have to keep turning? And could you please explain a little more?
Sure. I'm not a pulmonologist, but I'm going to try. In our maximum surface area of our lungs are in the chest wall, right? So in the front, you have your heart, but in the back, it's just the lungs. By trying to sleep prone means basically sleeping on your tummy. So doing adult tummy time, that's what we call it, adult tummy time. So by trying to go on your tummy, we are opening up as much surface area as possible for the air shunting to occur. So we have increased surface area and shunting of the air towards that site to hopefully increase the oxygenation of your blood. And that is the whole basis of proning. Proning has definitely shown a significant improvement in patients who are specifically more critical, more severe and critical illness, where their oxygen levels were low, and by flipping them over, they definitely see an improvement in the gases, and they improved in the oxygen amount in the gases. So proning is something to try and increase the surface area of your sites. Now, proning is very, very difficult to do. You go into the hospital, you've got EKG leads, you've got your nasal tube, you've got your mask on your face, and to sleep on the prone is very, very difficult. So we understand that, but as much as possible, I think it is absolutely required. Sleeping on your back is probably the worst thing you can do for yourself, Please do not do that. Try and sleep on the sides as much as possible. So kind of flipping back and forth from left side to your tummy, to your right side, and back and forth in those three positions is going to be important. One thing that's important with proning is we ask you to sleep prone for a longer period of time, like 30-minute stretches, an hour stretches, but always give relief to your sites. By staying on the bed, one thing I mentioned before is you don't realize how fatigued you are with COVID. You are definitely very, very fatigued. So once you go in a position, it's very hard to really move that position out. So it's very important to keep your bony prominences. So whatever is very bony and is going to cause pressure, please make sure that you take care of that. So sleep on a pillow on your chest, sleep a pillow on your pelvis, sleep a pillow on your, sleep on the pillow on your knees when you're in that prone position, when you're in the opposite position, because you want to keep the pressure off these particular areas so that you don't cause trauma to those areas. In patients, especially if those who are intubated or those who are in the ICU, it's really important because they can't really shift. When you guys feel uncomfortable, you will shift your position to kind of help relieve it. But those who are already sedated or those who have got, who are unconscious because of the ventilator settings, etc., they don't know that they have problems and they can have much more injuries to those points. So proning with pillows under your shoulders, pillows on your pelvis, pillows on your knees, switch over, sleep on your tummy, try and sleep as much as possible. And then if you can't, or you have to take some time off or whatever, go on your right, go on your left.
Okay. So adult tummy time definitely works.
Yes, it does.
Okay, brilliant. Doctor, let's speak about vaccine and laxity in social distancing. Thoughts?
So vaccine is required. Everybody needs to step up and do the job and get vaccinated. The only way we can get rid of this particular, the only way that we can get rid of this particular disease is going to be if majority of us are able to get immune to this particular virus, either through natural immunity, which I hope you don't get or don't get sick with it, but or else with a vaccine. We know that natural immunity lasts for at least 30 to, well, at least 90 days, 3 months, maybe a little bit more, but at least 90 days of effective natural immunity. But then your immunity kind of wanes after the 75th to 78th day. That's what the studies have shown, that you have a pretty steady level of antibodies and then they kind of dip after the last 15 days prior to that 90-day period. With vaccines, we know, at least as of this point, that the vaccine data is effective up until the antibody levels is effective up until 6 months post vaccinations, at least for the data that we have at US with the studies that we're doing. We hope that that particular antibody levels will be more durable as time goes on. But again, with whatever is happening in the world, if we don't get our vaccines, we are going to have these viral surges. We are going to have these outbreak surges. And the more virus we have, the more virus has time to mutate and develop more problems and more different strains, where maybe our vaccines may not work. As of now, we seem it is relatively good coverage. It may not be 100%, it may be a little bit lower, but at least it's some coverage. But as time goes on, if people don't get vaccinated, there will be these pools of clusters of infections that's going to be kind of spreading around, where the virus, it's normal for the virus to mutate. It's the survival of fittest, right? So the virus mutates constantly. And the more mutations we see, the more we acquire, the more illness and the more chances of us escaping that particular immune spike protein antibodies that we are forming with a vaccine. So we really want to try and get the vaccines done sooner rather than later so that we have ability to get this infection under control, this pandemic under control. So I think it's an absolute must.
Okay, and social distancing goes with that regardless of whether you've got the vaccine or not, right?
Absolutely right. Vaccine is going to be preventative. Remember, the vaccine studies have been done in patients who are relatively well, who had comorbid conditions. So they had diabetes and they had cancers and they had all that, but they weren't actively having cancers. They weren't actively under certain serious illnesses, etc. So that 100% correlate, 95% correlate, at least for the mRNAs, and nearly 71 to 85% with the AstraZeneca, the Covishield, etc., is great, is fantastic. But do remember there will be subgroup of patients where you may not be able to mount that response. You may be under cancer chemotherapy where you don't form any antibodies, or you may be a transplant patient who doesn't form any antibodies. So you're always going to have small amount of subgroup of patients where they are not going to be well protected. So keeping them safe, keeping your loved ones safe is probably going to be very important. So us putting a mask on is going to be important, because even though we've had the vaccine prevents severity of illness. It does not prevent you from getting asymptomatic disease or mild disease. So we could still be carrying it, and then we can pass it on to our family members who are at higher risk because they never formed the antibody response. So I think keeping social distancing and masking is a must, regardless of yes or no vaccine.
Okay, brilliant. So that actually answers one of our YouTube viewers, Monica Verma. I'm sure you could see her question. How prone are you to getting the infection if you're already vaccinated? So you answered that perfectly. Thank you so much. There's another one from Sonam Kalra. I had my first vaccine just before I got COVID. When can I have my second jab now that I've already got COVID, and how many days do I have to wait?
Hi, Sonam. That question has been asked multiple times, both here in US by all of our physicians and friends, as well as you guys. So the thing that we have to remember is that twofold, right? One, when you have COVID, you want to be socially distancing. So for 14 days, you really don't want to get out of your house. So the least amount of time that you want to stay away from getting your second jab is so that you don't spread that disease to anybody else. That's the first civic duty that you have, right? So that you don't want to spread it out to anybody else. And the second is when to get the actual vaccine. So as I mentioned before, with natural immunity after COVID, you can have probably up to 3 months, maybe more down the road. We'll know more, but as of now, we know up to 3 months. So you have effect up to 3 months. You could wait up to 3 months to get that particular vaccine. You don't have to wait. You can wait. The third civic duty that I would say is the reason why we ask you to wait is while you're waiting because you have immunity, somebody else can get that first jab and have at least a 50 to 70% chance of being cured or being prevented from COVID. So give them a chance, because we know that there is a dearth of vaccines everywhere. So it is just to try and help get everybody vaccinated. I think it'll be good to wait for the 90 days.
Okay, great. Ms. Priyanka Gupta has another question. What is the possibility of reinfection within 90 days of recovering? As you said, 75 to 80 days, your studies have been noticing that your antibodies are primo and then suddenly they dip, right?
Yes, so that study is actually from China, when they had done patients who recovered, and then they kind of followed them throughout the whole time. In the Pfizer and Moderna studies, it actually is pretty good post-vaccines. The data of natural immunity comes from UK, China, and also from US, where they have about 90 to 120 days is what they feel is appropriate. So CDC basically recommends 90 days as being the natural immunity time period, at least as of now. Again, it's a very fluid status. Things today is totally wrong tomorrow, and it's archaic tomorrow, and it's tabled off. So again, as of today, it is about 90 days. Now, regarding your question, can you get reinfection in 90 days? The rate of reinfection so far has been very low. I think that'll all come into play with the various strains that's going to come along. We, at least as of now, in US and in UK, where the most common strains have been very well protected with the prior first round of infection, as well as with the vaccines. There have been only 7 or 8 cases that were identified up until January of this year. Now, as I said, things may change based upon the new mutant strains that may come out. I know there's a lot in the social media regarding the ineffectiveness or reinfection rates even after having the first vaccines. Again, I don't have the exact data for India, but I think the reinfection rates overall is low.
Okay. Before we move on to Sonam's question, there's something I know you wanted to touch upon, Doctor, earlier. What would you say about post-COVID care, especially for those who are released from the hospital because they're doing a bit better but are still infected?
Right. So again, as you had mentioned before regarding the surge and bottlenecking, right? So in the hope to empty up a bed in the hospital, um, even in US last year at the same time, we did the exact same thing. What India is doing is to try and get the patient stabilized enough to be able to go to the next step, to take down to the next convalescent phase. That particular time period, depending upon how sick they were and what symptoms occurred or what illnesses occurred, they may be going home with more than one or two medications back home. Some of them could be a blood thinner because they had clots. So again, being a blood thinner, you have a risk of bleeding. So you have to be watching out for those situations. There's some patients who actually, at least in US here, who have low oxygen levels to the 90s or 88s, etc. But with 2 liters, they do fine. And we actually let them go home on the oxygen cylinders. So they may be going home with the oxygen on board, and they kind of following up with their medical doctor or their pulmonary doctor is going to be very important. With the patients who are having elderly patients, for example, elderly patients with COVID, we've noticed them, they were frail to begin with, and then with COVID, they really got super frail. They're very disoriented, they have a high risk of fall, they have just disorientation to the whole environment. So again, getting them to a safe home, which again is important because you want to get them home and yet not infect your loved ones. So there may be a step. I know I've heard about various centers that are there in India also, where you have a subacute kind of place where they will be able to help you with your activities of daily living, your washing, your bathing, etc. They can help you with your foods and meals. They can help you with the oxygen cylinders. They can keep a watch on you on your vitals if you are able not to do so at home. So I think getting to certain areas where they can give us a little bit more extra help, I think may be a good idea.
Okay.
And then also regarding the post-COVID syndrome, we are all learning. We are learning that there are effects, skin rashes, strokes, confusions, something called BOOP, where you have these inflammatory things in your lungs that kind of come and go with fevers, with shortness of breath, staying
What?
longer.
Boops?
Yeah, that's what it's called. It's bronchial obliterance organizing pneumonia. It is not infectious, it's inflammatory, but
Okay.
but it can occur in these patients post-infection a few months down the road, or a few weeks to a few months down the road, where they suddenly start getting shortness of breath again and they start getting fevers again. And if you do a CAT scan, they have these new spots in the lungs. And you give them steroids, the spots goes away and then comes right back. So again, we know that's an inflammatory response to it. But again, with the use of steroids, etc., you have to always rule out infection. So while they're in the hospital, that's another reason not to get into the hospital, is you want to try and prevent any kind of nosocomial stuff. But if they're in the hospital, they're so sick that they required all these steroids, they required other immune mediating medications, etc., they are at a higher risk of infections. They're higher risk of reactivating tuberculosis. They're higher risk of getting reactivating hepatitis B. They're higher risk of having mucormycosis, which is a fungal infection, which is or bacterial infections because you've got multiple lines in you, etc. So they could be coming out with various other medications that would need to be taken at home. So somebody to help them through at that particular time in the acute convalescent phase is also very important.
Okay.
Keep in mind.
I think for Sonam's question, which is on the screen, I think you've covered the watch out for post 20 days bit quite well, Doctor. Could you suggest a few lung care, exercises or processes that we can do post COVID? In
I
your
have to admit, I don't know any, but I know I have been told by my mom and by the WhatsApp doc as to the number of breathing exercises to be done. I have been told by my sister who does yoga regarding the yoga exercises. again, I tried, and I think pretty much the baseline of all of these exercises is deep breathing exercises. We don't realize that we really don't take good deep breaths. We don't open up our lungs. We don't inflate our lungs as much as we normally should. So I think learning some of our pulmonary rehabilitation is going to be important. So just like learning good deep breathing exercises to open up your lungs as much as possible, taking long walks to try and help increase your stamina, and your overall core strength is going to be important. There are some patients who get very dizzy when they have orthostatic changes. That's something called POTS, P-O-T-S, which is something that we are seeing post-COVID. So again, watching your blood pressure when you're getting up and sitting down. Again, cardiac rehabilitation and lung rehabilitation is going to be required for those post-COVID syndromes. So those are things that can happen down the road.
Okay. And okay, so we've got another question, doctor, from Ms. Dipali Singhal. She says, can Febiflu be a substitute for Remdesivir? Do you?
The data, at least that we have so far, both NIH and CDC and the China data, really have not shown a positive outcome with either drop in mortality or improvement in clinical syndromes with the use of Febiflu. So really, there is no data to say that that would be as efficacious or effective even. So Remdesivir is a special class on its own. So far, this is the only true antiviral that we have so far that does work against SARS-CoV-2.
Okay, great. Priyanka Gupta asks, what to do if the doctor has prescribed steroids right in the beginning and the patient has taken it?
It happens. And again, as I said, COVID has been, it's been phenomenal to treat patients with COVID. What we did in March, we didn't do on April. What we did in April, we said, was totally wrong in May. And what we did in May was probably the same thing that we did in March. So again, it's a fluid situation. Things go up and down. I think just being on top of what the guidelines are is going to be important. And the guidelines changed. Whenever we're looking at the guidelines, we actually look at when was it revised, because each version keeps changing out. So AIMS has a fantastic COVID protocol that's present that you could look for that could help through with it. Now, in your question specifically, Priyanka, it says, what do you do if you've already taken it? Really nothing. We just have to wait it out. Many a times, as I said, 80% of times, the disease resolves by itself, and really nothing, no negative outcomes comes out of it. And I really hope that your loved one will have the same outcome.
Great. Doctor, would you suggest any, dietary restrictions, or rather any dietary prescriptions?
No jalebis, that's for sure. So okay. as you were telling me earlier regarding that you saw this particular, you shouldn't get jalebi, right?
Yes.
No, I don't think there's really any specific restrictions or recommendations. I think a balanced diet is a balanced diet. It's good for you overall. It's good for your heart. It's good for your lungs. It's good for your body. And I think trying to be aware of what you put in your mouth is going to be important. One thing that we do say is those patients who are having a lot of fluid buildup because they're taking excessive salt, etc. Maybe you want to be like, they have heart conditions, they take excessive salt and they have, fluid buildup, etc. We want them to be a little bit more careful. Just being a healthy heart diet is probably what's going to be required. There's really no restrictions that you can and you cannot do. It's not that, if you take garlic every day, it's going to prevent it. I don't think that, it's really shown that much yet. Taking fruits and vegetables with vitamin C is great. Don't overgo on it. A little bit is good, and a little bit. I know we've heard about vitamin D and zinc and calcium and what was the third one? I think it's zinc, vitamin D, and vitamin C are the three things that they talk about. There's some basis to those agents because some of the diseases have shown a positive impact with the immune modulation that these supplements do. But again, there's been no clinical trials to show one or the other has made a positive impact. Is there going to be a harm? Not if you don't overdo it. Like, I don't want you to be taking 5,000 cc's of vitamin C just because you've got COVID. No, please don't do that. So just daily requirements is, I think, good enough.
Okay, brilliant. Mr. Rakesh Kumar has a question. Are there any side effects after being diagnosed with COVID-19? Because I have been experiencing some issues in my right eye. Wow. Sometimes it flickers and gets smaller compared to my left eye. Please advise. Wow. Okay.
I am actually going to defer that question. I think you do need to see a medical physician to be able to get a better answer. I personally do not know of that particular symptom occurring post-COVID, but I would like you to please see a medical doctor to get it looked at and checked out.
Okay. And okay, Monica's got another question. Do the family have to be careful by the returning patient from the hospital? So I think this will have two parts, right? If they're discharged because they're improving versus if they're discharged because they've completely healed. So maybe you could
Correct.
two parts.
Okay. So you could go to the hospital and the ED will look at you, the emergency room departments will see you and they'll say, hey, your oxygen is not too bad. You don't look too good. I really don't have any beds. Please go home, take care, watch yourself. Now, obviously, you are still in that early phase. You're still in that mild to moderate phase at this point. So you are still infective. You have to be watchful of being in isolation for up to 14 days. We do notice there's a significant drop in infectiousness occurs by the second week. So the first 10 days to 14 days from the start of the symptoms is when you're most infectious with. So probably trying to maintain your isolation precautions and keeping the patient in a separate room during that particular time is important so that we don't spread it to anybody else. Those going in to drop the food or water, etc., please take your own precautions. Make sure you wash your hands religiously more often. Keep a mask on when you are in contact with your loved one who is sick and you're taking care of them. And then all frequently visited areas should be really cleaned down more often than not. So I think keeping isolation during that early phase is important. Now, as Vikrant was mentioning, that if you are being discharged after the end of 2 weeks or end of 3 weeks or whatever it takes to kind of get you better, by that time you're really not infectious. So really you don't have to worry about infectiousness to somebody else.
Okay, great. Oh, this is something that I personally wanted to know as well. Does steaming help or is it a timeline thing as well?
I don't know of the answer at all. You'll have to ask an Ayurvedic holistic person.
Okay.
I have no
Okay.
idea. Sorry.
Okay. Veera Ramaya wants to know, are there any home remedies that are effective?
I think just being aware of what you put in your mouth, what you drink, what you eat, and how you stay healthy, I think is important. I don't think there's anything specific that turns around. Remember, you can say, my mom says, oh, take this, or my uncle says, take that, and then you turn better. Remember, 80% of patients are going to get better. I don't know whether it got better because I took that one supplement or whether I just got better because I was supposed to get better anyways. So I think there isn't anything specific that we know of as yet that is a positive impact. I think keeping a good overall well-balanced food, water intake, etc., is going to be important.
And with the water, of course, we need to watch for our electrolytes. So the salts, as you mentioned earlier, right?
Yeah, just because, especially when you're having a lot of fever and you're sweating a lot, you're losing a lot of your salt along with the water that you don't realize. Like you're having fevers every day and you're clammy and you've got bed sheets that are wet. I think you're losing a lot more than that way.
Okay. Okay. Here's the last question for the day, right? Could you please comment on the use of ivermectin in COVID? Is there any role?
So ivermectin has been approved for various parasitic infections, and it's a fantastic drug for that. It does have antiviral effect. but the amount of ivermectin that you need to really be effective in case of COVID is going to be nearly 70 or 80 times that dose. So the dose that we're giving of 400 milligrams is not effective, at least in vitro, with the studies that has been done, to show that it has a maximum, that it will have an effect of getting the virus killed. So I think ivermectin needs a lot more of a clinical trial use before for its efficacy before we should be recommending it to everybody. That's what we do in US. We do not recommend ivermectin, but again, there may be some population that it may be effective for in India, possibly.
Right. Dr. Anu, I know this, I said that's the last one, but we have just one final query for you, if that's okay.
Sure.
Brilliant. We have it up. Thank you. Sonam wants to know, what are the follow-up tests one should do post-COVID, say a month later, blood work, CT, heart scans? Well, it's a good question.
So I think it's a great question, Sonam. I think that question is totally dependent upon when you left the hospital, what were your symptoms and what were your effects of COVID that happened. If you had just a pneumonia and your CAT scan showed significant damage, then maybe I would say probably 6 to 8 weeks later, you may want to get a CAT scan just to see where we are, especially now that we know that there could be possibility of post-COVID related issues down the road. Regarding heart, I'm not sure. Again, COVID can cause viral infections of the heart, and it actually can cause viral myocarditis, where your heart function really declines. And in that scenario, you could potentially be required by a cardiologist to follow up based upon how severe your disease was, maybe sooner than a month, maybe later than a month. So it depends upon how sick you were and with what condition. Regarding routine blood work, when a patient leaves the hospital, it's really not required. Again, if somebody just goes in, gets well recovered and goes home, we really don't recommend any specific tests or CAT scans or x-rays to be done. We assume that the patient's going to turn around and has done well and will continue to do well. If there are abnormalities, if you're taking medications, for example, maybe there will be some need for doing some testing at that point, but there's no specific requirements. If everything went well and you turned around, it was just pure COVID, and you turned around and you went home, nothing as specific is required.
Brilliant. Okay, that's all. Thank you so much for your time, Doctor. In this world of chaos and misinformation, you've been this brilliant ray of sun of primary data and information for us. Thank you so much. Yes, would you like to add something?
Thank you very much. It's my honor to be here. It's my honor to give back as much as I can and to educate if I can. Even if 5 people hear it, I think it's good enough. So thank you very much for having me here.
Thank you. Thank you so much, Doctor. So the 1947 Partition Archives will be hosting several more episodes in different dialects and languages from across India. They will be held several times a week at 9 a.m. India time. Follow us on Facebook and subscribe on YouTube to catch all the episodes. Thank you so much for attending today, and we hope to see you next time. Thank you.
Bye-bye.